Okay, so I just got out of the shower, and I'm going to try and do this before my kids realize that I'm out of the shower. It was hard enough to get in the shower. So they're in their bedroom playing right now, nicely, so I have some time. Anyways, I am 18 weeks pregnant and 1 day. So I turned 18 weeks yesterday on a Thursday. And let's see. So it's been a while since I updated these vlogs. You know, the early pregnancy stuff, there's not too much to talk about. There's not a lot going on. You know, it's kind of boring, and just every week it would be same from last week. So I figured I'd just clump a few all together for the first couple of months of pregnancy. And then hopefully we'll have more regular ones from here on out. Anyways, it's February 25th, and I have had 3 midwife visits, including the consultation, the first, meetup where we didn't really do anything pregnancy related. We just kind of met each other. Then we had the first one, and let's see, that was like the preliminary, stuff, and she wanted to try and get some lab work done. As I recall, it was rather tough to get down there because, if I'm remembering right, that was the one where we also did the ultrasound. Yes, because like I said in my last vlog, we were planning to go on the one that weekend, I think, but we had to cancel it because it had like a freak snowstorm. Yeah, and my dad was coming up to visit, and he was here, and there was just this freak dumpage of snow, like 6 inches of snow, and we're in Southern California, so that never happens. And so Californians were like, oh, what do we do? Close the roads! So we couldn't get down to Bakersfield to have our ultrasounds. I had to call and cancel again. So we scheduled it for the week after. That was the first official midwife meeting, and we met her at a doctor's office that is okay with, midwives and, letting patients go off and do their thing. Don't get me started on doctors. Anyways, she is solely based on home births, so she doesn't have like a birth center or anything like that. No ultrasound equipment. So any lab work or ultrasound stuff that she does, she refers to another doctor. And here come my kids. Couldn't possibly last very long. Okay, anyways, my kids came out and threw me off. So we had the ultrasound. We met her at the doctor's office. And it was just a very quick little look. I mean, it lasted like 2 minutes, not even. I was rather disappointed because I wanted to hopefully see the baby move or kick or something, and it was too early to tell the gender anyway, so I wasn't worried about that. So I just wanted to, watch my baby for a little bit, but he just went in there, did the measurement, because it was primarily to find out how far along I was in my due date, because I had no clue. Like I had said before, I could have been anywhere from like 9 to like 12 or 13 weeks. I don't know. I can't remember what I thought I was. But when I took the pregnancy test and got a positive, I just started counting from 5 weeks right then. So I just figured I was 5 weeks. But I really had absolutely no clue at all. So what's funny is when I had the ultrasound, according to my guesstimation, I would have been 11 weeks and 4 days, and that is exactly what the baby measured. And I was completely blown away. I'm like, really? Are we just right on the nose like that, huh? So that was really neat.
Aww. Look at the little baby in there.
Is that a stick?
Just one.
Look at the baby.
So
See?
far.
Can you see the baby's head?
Yeah.
Can you see his little hand up there by his head?
Yes.
That's your little brother or sister.
Is it a boy?
11 weeks
no, we
and
don't
4
know.
days.
I think.
Oh my
it's a
gosh,
girl.
really?
How many? What is
That's
this?
exactly what I thought I was.
11 weeks and 4 days?
Yeah.
Oh, wow. Good for you.
Right on the nose. Look at
Isn't
the
that
little
amazing?
heart. There's your heart's beating.
Look at baby.
Isn't it cute? That's cute.
Looks like it has
little
monkey
baby.
arms.
So cute.
Yep,
What's the heart rate?
that's the heart rate. 170. There's not a whole lot to get.
Yeah.
And then we went to her house and had our first official appointment. And, you know, like, she took my history and we chit-chatted about stuff like why I wanted a home birth and, you know, all the information I knew about vice versa, home birth versus hospital births, and why we chose to have a home birth and go with a midwife, which I'm so happy we finally did, because over the years my animosity toward doctors and all their procedures has grown even stronger. So I can't even look at the birth of Lorelai without getting angry, because, you know, a lot of the stuff they do in hospital births is just so totally unnecessary and not really good for you or your baby. For instance, when they put that tube down the baby's nose and throat to suck out the mucus, you might think, oh yeah, you know, that's good, that's helpful for, you know, you have to get that out of there. But in reality, I mean, how would you like to have a, you know, tube sucked down your nose when all you need to do really is sneeze or cough, you know? So you're like, oh, I need to sneeze, and they're like, here, have a tube. So, you know, that's one thing. Cutting the cord immediately after the baby comes out, and then they wonder why babies have, you know, like, low blood count or something like that. So just a lot of it is not necessary. And if you do the research and, you know, think with your big brain instead of your money brain, then you realize that there are better ways to do things. So I'm really excited about, you know, having a birth at home with the way I want it. So she tried to do a blood draw, but I'm already a really, really tough stick just whenever I get my blood drawn. Plus, I hadn't drinking enough that day. Sorry, my skin is really itchy. So my veins were like super hidden. And she tried like both arms, hands, and, you know, the crook of my arm. And I think she even, she tried to do my foot too. So, we tried jumping up and down and like running my arms under warm water and drinking more, and we just couldn't get a stick. So she just, mainly what she wanted labs for was to check my CBC, my blood count, to make sure my iron levels were okay. But she did that with a finger poke. So, she said that they're just a little low, which I'm not surprised because I don't eat a lot of iron-rich foods like meat. So, she just, you know, she suggested some, you know, things to help bring up my iron. So I am taking alfalfa, which is supposed to be really good for that. And, you know, also it's like good for you for anything just to take. It's really good for you. It's like an extra vegetable supplement, you know. So I take 3 capsules twice a day. They say to take it 3 times a day, but I usually forget the lunch one. So it's 405 milligrams, and I take 3. So and then, you know, she suggested like shrimp, which I was doing for a while, but I got really sick of it. Just shrimp with cocktail sauce I was doing, and that's supposed to be really good for your iron. And I have been eating a lot of cream of wheat, which is super high in iron, and fortified cereals, so that's good. She didn't poke my finger the last time I was there, so I don't know what my levels were then, but I've been feeling better, so I think the iron therapy is working. And I lost 8 pounds in between visits. So within a month I lost 8 pounds, which is awesome. You know, usually when I'm pregnant, I lose weight anyway. The baby just sucks the fat right off me, and whatever's left over is purely baby, and I lose that anyway, so it's normal for me. That's how both my other kids were, so we're not worried about it, and I'm big to start with, so it's not really a problem or worrisome. And the last time we had a midwife appointment, I don't know, like 2-3 weeks ago, we got to listen to the heart rate, and that was really neat because it took like 2 or 3 minutes to find it, and at that age I've seen like it take like 10 minutes to find it, 7-10 minutes. So we found it rather quickly. The baby was bouncing around a little bit. As soon as she put the Doppler right there, I heard a little quick, and then it went away. So baby moved, and she kept chasing baby around, and finally cornered it.
Are you ready to listen? I'm down here just in case.
Listen good, we're going to hear the baby.
At this point, you know how they are. They can be just about anywhere.
Tiny still.
Here. Oh, next thing to say.
Did it wiggle away?
It wiggled away.
I heard it do that before earlier too.
You did?
Yeah. It's like a quicker beat, and then it went away.
Well, we know your little baby's in there somewhere. And it's just wandering around. It's trying to hide from
Or like a train sound.
you.
It's like a train.
Yeah, it's like train sound.
Where's that train sound going? There you go. Hear it?
Yeah. Let's go choo choo, choo choo, and
You hear that?
yeah,
Sounds like a train on the tracks, huh?
yeah. We want to see that train.
It's about 1:40.
Which leads me to old wives' tales with gender determination, because they say a heart rate of 140 or higher is a girl, and below 140 is a boy. So it's like right at the median of that. It's like, okay, it's 140, so 140 or higher is a girl. So, you know, but with Gideon, it was above 140, and my mother-in-law said that that could be a girl or a left-handed boy, and he's a left-handed boy. So you never know with that. I keep wanting to say midwife tale, but it's a old wives' tale. Okay, so then I also took some gender prediction quizzes on parents.com just for fun, and they asked questions like, you know, what are you craving, salty or sweet, you know, obscure pregnancy questions. And I took 2 different tests, and they both came up with Don't know. Sorry. Could be either.